Post-traumatic stress disorder is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist attack, war, combat, or rape, or who have been threatened with death, sexual violence, or serious injury. PTSD has been known by many names in the past, such as shell shock during the years of World War I and combat fatigue after World War II. But PTSD does not just happen to combat veterans. PTSD can occur in all people of all ethnicity, nationality, or culture, and at any age. How does PTSD affect addiction? People with PTSD are more prone to violent outbursts and panic attacks, which can be difficult for people and friends to witness. Feelings of guilt over these outbursts can drive those with PTSD to self-medicate with drugs and alcohol. Continued use of alcohol or other drugs in this way can lead to an addiction. Can you get PTSD from addiction? Substance abuse and addiction is commonly connected to co-occurring disorders like PTSD, depression, and anxiety. People seeking treatment for PTSD are 14 times more likely to also be diagnosed with a substance abuse disorder. Drugs can seem like a perfect solution to this particular cluster of problems. And according to studies, 21 to 43% of people who have PTSD also have a substance abuse problem. Do people with PTSD drink more? People with PTSD are more likely to have drinking problems. Also, people with drinking problems often have PTSD. Having PTSD and alcohol use problems at the same time can make the symptoms of each worse. Is PTSD more common in males or females? Women are more than twice as likely to develop PTSD than men, 10% for women and 4% for men. There are a few reasons women might get PTSD more than men. Women are more likely to experience sexual assault. Sexual assault is more likely to cause PTSD than many other events. Will PTSD ever go away? PTSD does not always last forever, even without treatment. Sometimes the effects of PTSD will go away after a few months. Sometimes they may last for years or longer. Most people who have PTSD will slowly get better, but many people will have problems that do not go away. As people age, their PTSD symptoms may suddenly appear or become worse, causing them to act differently. It may be unsettling to see these changes in a loved one, but it's nothing to fear. Changes are common, and treatment can help. The most common events leading to the development of PTSD include combat exposure, childhood physical abuse, and sexual violence. Can drugs make PTSD worse? Many people turn to drugs, alcohol, or nicotine to try to cope with symptoms of PTSD. However, substances can make existing PTSD symptoms worse or even lead to substance use disorder. Alcohol and drugs can affect health, relationship, work, and education, whether you have PTSD or not. Drinking often can contribute to PTSD symptoms and increase irritability, depression, and feeling off guard. Some drink to deal with insomnia that results from anxiety, anticipating nightmares, and circular thinking. Drinking actually impairs the quality of your sleep, setting up a destructive cycle. What will happen if PTSD is left untreated? Untreated PTSD from any trauma is unlikely to disappear and can contribute to chronic pain, depression, drug and alcohol abuse, and sleep problems that impede a person's ability to work and interact with others. Trauma disorders are a common and costly problem in the United States. An estimated 5.2 million American adults ages 18 to 54, or approximately 3.6% of people in that age group in a given year, have PTSD. In 1990, anxiety disorders cost the United States an estimated $46.6 billion. Alcohol and drug use can only worsen the effects and outcomes from PTSD. Self-medication is not the solution. PTSD is treatable. With professional help, PTSD as well as drug and alcohol challenges can be successfully managed. For more information regarding addiction, please contact us at the Institute for Addiction Study. Our link is in the description.